Minister, thanks for your time. Quarterly report on aged care partly makes a pretty dire reading. So 805 residential providers lost $465 million for the quarter. Only a quarter of people live in profitable homes. Is this a crisis?
I've never walked away from the fact that I inherited an aged care crisis, and that's why the government made it such a pinnacle of our election campaign that we would take urgent steps to address that. So the quarterly financial reports are hugely concerning, but I also don't think they're that surprising for people that know the sector and have been pointing to this for a long time. I guess in terms of people who want hope and they want a sense that government is doing something about it, this quarter is the last quarter before the new funding model, ANAC, commenced on 1 October last year. That was the first piece of legislation that the Albanese government put through both houses to start dealing with the aged care crisis. So it is our hope that the next quarterly financial report coming will give us a better sense of where things are at now that we have the ANAC funding model in place, noting that even that model itself is going to need to be constantly looked at and addressed to keep it up to date.
Right. And when you say a look or understanding, when we talk about a quarter of people living in profitable homes, which means the home's sustainable, right? It can keep existing and people will keep running it. What would you expect that to lift to in the next report with the new funding model?
Well, there's the ANAC funding model, which gave a 10% uplift to all beds in the sector. There's also the IHACPA funding coming 1 July, which is the Independent Pricing Authority that, again, was another recommendation of the Royal Commission that will actually address costs as, I guess we'll call it real costs rather than being sort of a nominated position of government. So that's another lift that is coming for the sector. And I would also say that ANAC is supposed to better address the actual costs, because what it looks like to fund you if you have dementia in Rockhampton is very different to you in my suburban electorate of Lilley in Brisbane.
Right. But is there, you know, what's your hope of what that level will get to? Because at the moment, three quarters of these homes are not on a sustainable footing.
No.
I mean, if they were running like this and it kept happening, ultimately, why would you keep running them? So what level do you think they can get to? Because this is an instant change in funding, essentially. What do you think that number goes up to in terms of profitability?
Well, I guess the thing about those reports doesn't take into account the hotel and accommodation side of things for providers in the sector, and people have really different ways of how they fund and cross-fund those issues, whether it be care, hotel, accommodation. Obviously, the government has put billions and billions of dollars into care, into lifting the standards of care, and things like our initiatives of 24/7 nurses and care minutes are fully funded by the government. But I think the broader point that you're making is that we have to have a conversation about the sustainability of aged care in this country, and I think really it is probably the greatest unaddressed question of the Royal Commission for us to look at.
And does it mean the answer is always going to be more government dollars?
No, I don't think that is the only option. I mean, what the Royal Commission asked us to
If people are saying it's expensive and also providers are saying we're struggling to make a buck.
But not all providers are struggling to make a buck. There's plenty of very profitable providers out there. The reports that have come in say the sector is in crisis, and I would point specifically to workforce being the reason for that, and people at the moment having to pay huge costs in agency workers. That is sort of an unsustainable and spiralling cost.
Let's get on to workforce, because there was an election promise for a nurse on site every aged care home 24 hours a day by the middle of this year.
Yes.
Is that still going to happen?
Yep, we're hopeful that's going to happen at the moment.
Hopeful.
We're
so
hopeful.
Not confident?
Well, I'm saying hopeful. We set that as our goal. We have funded providers to meet that goal. We know at the moment more than 80% are meeting that goal. We know that another about 9% are very close to it and working diligently to get there by 1 July. We also know there's probably about 5% out there, particularly in our rural, remote areas, that will not meet it because of the workforce shortages in rural and remote areas. And that's why from 1 April, we're opening the door for people to come and talk to us about the exemptions that they'll need. And we expect probably about 5% to need exemptions, which is to say they're going to have some other arrangement in place to make sure that residents in their care get that care 24/7.
So you're hopeful of 95 rather than 100, essentially, and 5%. What would the alternative be, to have someone they can get on call within half an hour, or what does that look like?
It looks, I mean, a lot of those arrangements are in place as we speak because they can't get a nurse 24/7 now. I mean, many of these facilities have been doing this for years because it's good clinical practice. So in some instances, I know when I was up in Rockhampton, a facility that they looked after at an hour north had on-call nurse essentially who could drive in instances that they needed to. So that might be an instance. What we're asking of centres, like, I'm not going to be wearing a GoPro and Blundstones and kicking down the front door of facilities come 1 July to say I'm shutting you down because you haven't met it. We will work with facilities to make them either get there or put in place adequate arrangements to make sure that care...
And if they don't, what does happen?
If they don't, what does happen? Well, 24/7 nurses is actually a supplement that federal government is paying. So if you do not meet the requirement, you will not get that supplement. That's what I said when I said we're funding it in full. So I would call that more of a carrot than a stick approach. But if you don't meet it come 1 July, you're going to need to explain yourself why you haven't been able to meet it, and if you have taken all reasonable measures to do so, and if you've come to us beforehand, we will just continue to work with you to get it.
But I mean, this is obviously a safety thing. So if a facilities or a home is found to repeatedly not met it, they haven't taken those steps, what happens? Can they be...
Well, that's the usual process of sanctions that the Commission runs and administers, and this is not a sanctionable offence. But probably it is the case that if you're a facility that can't meet it, has had problems in the past, you are already well known to the Commission as a facility that needs additional support. So if you are unable to meet 24/7 come 1 July, the doors are open from 1 April to people to come to us and say, we're worried about not being able to meet it.
Here's why I can't do it. Because some of them are saying, we're trying. We've tried for a year, we can't get someone.
That's right. And so they will be able to apply for an exemption come 1 April, and they'll be known to the Commission. They'll have shown that they've done everything they can to meet it. Here's a plan that they're having in place. My hope would be that come 1 July, when our 15% pay rise to the award kicks in, come the IHACPA funding kicking in after 1 July, come some of the other levers that we're pulling to address workforce shortages over in the immigration and citizenship space, fee-free TAFE places, some of the stuff that Jason Clare's looking at. All of these levers together are going to help us address workforce shortages, but I make no qualms about the fact that I can't fix a problem overnight that's taken 10 years to fester. No,
but there was a date to fix it by. It's not overnight, but that's the middle of the year date Labor gave from the Royal Commission.
We've already made, we're so close.
What's an example? What thing is normally needed for a nurse? 3 a.m. You need that nurse on call 24 hours. It's obviously when there's a proper emergency, they go to hospital like anyone else.
Well, I mean, I think...
What's more common to need this nurse for?
Oh, medication, wound dressing, stuff that comes up overnight, and UTIs are an issue in aged care. So some facilities, particularly out in the regions, have successful nurse practitioner models, and some of the things we're looking at in workforce across the board in both the health and care economies is making sure that nurses can operate to full scope. Like, there's some good models out there of what people already do that are creative, where they can't have a doctor in there all the time. But we need to address this because the Royal Commission asked us to, because it's a good thing to do. We also need to address this because there's bed blocking issues and hospital issues across the board.
Also taking the stress off hospitals.
Yeah, I think it's a good thing to recognise where people are doing a great job, because we want more people to think that this is a place, an industry that I want to come and work.
Minister, thanks for your time today.